So, Dr. Boris, tell us a little bit, how is the connection with the teeth in our body? How does that work?
It's pretty interesting. Every tooth in our body connected with specific organs. As a Chinese medicine, they do acupuncture, so it's the same concept. So if you look on that diagram, sorry, just upside down, you see the front teeth connected with reproductive organs. The back teeth is connected with heart and intestine organs, and that's how important we can see if patient has any connection, any symptoms, any disease. We can just navigate and send the patient to the right physician, right doctors when we're done with dental treatment.
So, Dr. Boris, you have obviously seen people who have teeth that are damaged, and then there's a connection with their body. Can you give us an example, a case study of somebody that you've seen that happen with?
Yeah, some years ago I saw a young gentleman who has perfect teeth before and come in 1 year for just regular checkup and said, I have some problem in my eye tooth. When I look in eye tooth, I see big cavity on inside the ledge, which normally never happen. I look, it's a little bit strange, so I asked some questions and said, like, you have any problem in your reproductive organ? And he said, like, after 2 minutes, he said, yes, I got it a couple months ago. So then I just see like that tooth connected with reproductive organs, and I think, okay, that cavity probably either affect your organ or your organ affect the tooth, so it can be vice versa. That's very important to know.
Dr. Boris, there's an issue with people sleeping well, and there's so many problems that, especially women who are after 50, 60, complain they can't sleep well. But as a holistic dentist, you have a different spin on it. Can you explain that?
Sure, yes. We always look not just inside the mouth, we can look outside the mouth, we can see the posture of the patient, how they look, if any face changing, any bite problems. And when I see some bite changes and some problems, I always take a look inside the mouth, and I can see for example, if I can see open airway, restricted airway, and totally closed airway, and just because of the tongue position. If I can see tongue is pushing back on a little bit wide and up, then it's my concern. So we try to research more and ask some questions. How do patients sleep? How many hours of sleep? If most patients say, oh, I love to sleep. Oh, I sleep 8, 9, 10 hours, which means not normal. Person who has a good energy and no sleep problems, they have to be good energized in 6, 7 hours max. If they sleep longer, that means they don't get quality sleep. If we can find out the problem, we can use a referral to a physician, get a sleep test, and do sleep appliance, which is a double piece of plastic. It's BPA free, very strong. It's what it do is protect teeth from grinding. It's reduce snoring, that's also important for public, and it's open airway because we move the jaw forward. If jaw forward, tongue is forward. So we open airway behind, and person can sleep better and breathe better.